The NCD division conducted the STEP survey. So the STEP survey indicated that only 6% of Kenyans eat vegetables and fruit in the recommended portions as per WHO. This is quite telling because food less in vegetables and fruits is a big risk factor for non-communicable diseases like cancer, hypertension, diabetes, and individuals who eat food high in vegetables are also healthy in terms of their gut function is better because of the high roughage, and also it reduces their cancer and other non-communicable risks. And so we would urge Kenyans, because we are an agricultural country, instead of selling all the food in the market to buy meat and other delicacies, we have very healthy foods on our tables that we grow from our shambas. So ours is to ask Kenyans to use more of them for their food and for their children, and also sell a little to supplement with the fruits that they don't grow. The problem of non-communicable diseases is big. That was not something new. We knew that the NCD problem is big. But what we didn't know is the scale of the challenges in terms of prevention and promotion. You've already mentioned that we have a big problem of diet. I mean, very few people eat vegetables and fruits. Very few people are aware of their cancer risk. Very few people have been advised on smoking and alcohol, and all these are risk factors. Now, the biggest challenge we are having is a disempowered individual. An individual, a Kenyan who, one, is not aware of the risk factors of these diseases. Two, those who are aware, occasionally a few of them are in denial. And then three, the interface between the health worker and the environment in terms of people is not health promoting. Health workers don't tell individuals on how to live healthily. You know, our model is an illness model, that when you're sick is the only way you make sense to a health worker. But this is changing, and we are trying to invest in the space of, one, education. Education is key because an empowered individual is easy to prevent these diseases. They are easy to convince to screen, and when they are put on treatment, if they ever become ill, they comply more, and the outcomes become better. Now, the biggest challenge now currently in terms of NCDs is that people up to 60 to 70% of those who have the disease are not aware that they have the disease. So you're walking around with very high sugars, you're walking around with very high BPs, or you have a precursor of a cancer and you're just, doing your normal thing. It's not painful yet, and you have a swelling, or you're just ignoring it, or you're wait and see, the usual thing about us Kenyans. And by the time it becomes manifest that yes, this is a cancer, yes, this is diabetes, the disease is far much spread, the resources required to treat it are more, and the results are poor. So I think the message we are sending out to Kenya is, first and foremost, we need to empower ourselves with knowledge. The government is trying to do a lot of that. You don't have to go to the hospital or the health center when you're ill. Even when you're well, a health center, in fact, we are not calling them hospitals, we are calling them health facility, because it's supposed to be a facility for health, not only for the ill, but also for the well. So ours is just to promote that culture of wellness. When people embrace wellness, disease will be sorted out. People eat well, they smoke less, they don't drink, they do exercises, and more importantly, they screen themselves from some of these diseases.